Hi, everybody. Welcome to Dental Talk 360. I'm Dr. Alfredo Arauz. Welcome to another episode. Today, we have the pleasure of interviewing Dr. Jose
Aquino.
He does body contouring plastic surgery in Miami, Florida. Can you please tell us a little bit about yourself, Doc?
Well, you just said it. My name is Jose Aquino.
There you go.
I'm originally from Dominican Republic, and I came here to the States. I did my training in plastic surgery, and I have my practice here in Miami. I mostly do breast and body contouring. I also do the other procedures, but I am mostly known for doing those kind of procedures.
What got you into that path of really streamlining your practice to body contouring and breast surgery?
So it's interesting because during my training, my training was very concentrated in face.
Okay.
It was heavy in face. But when I came to Miami, the environment, population.
It does lend itself to it.
Right. It was not gravitating toward face. It was most gravitating towards body. So I had to change my path. So I ended up doing mostly body contouring procedures and breasts. And now that's how I got known for.
So is that the majority of your practice now? What you would say the percentages from body contouring to any other plastic surgeries within your practice?
I will say that that's like 99%.
Very nice. And that's like a good thing for just, we have a lot of doctors that follow us, and sometimes you start one path and you end up being somewhere completely
100%.
But it's what it's meant to be, Like I like surgery a lot, and I did a lot, and now like I don't really want to do any surgery, Just doing mainly.
You definitely went one way.
I went one way. Exactly. I was like opposites. But
it allows you to see that. And I'm sure for you, having face training has really helped you within the body contouring, right?
Right.
It gives you a perspective.
Yeah, because for face procedures, you had to be more detail oriented. So I brought that to body contouring. So my body contouring is very detail oriented. It's very respectful of the anatomy. So you have to do that. So for me, it was at the beginning it was hard because I really was not very experienced initially doing that. But you had to do it. So you have to do it. The environment led me to that, and I feel right now I say to myself, wow, I really love this now. And that's the thing about plastic surgery as well. That is the diversity of things that you could do.
When do you delineate that line? Because I love that you said you keep it as natural as you can to keep it as aesthetic as possible. In the world where we live in Miami and we see these ridiculous BBLs and ridiculous breast augmentations that just look perfect. The same goes with dentistry, right? We'll get those patients that come in with huge ceramic. It looks like the old, I'm going to date myself, chiclet teeth.
Yeah.
Right? They don't look right. They look like laminate floor tile. What differentiates when you're talking to a patient that you see that kind of wants to technically get themselves botched by their aesthetic expectation? How do you change their course, or how do you go through with doing it the way you see it with your eye to be more artistry?
Right. So I always say my number one thing for to my patients is that we always have to respect the anatomy. Not because respecting the anatomy is going to give you a better outcome, but it's also likely going to prevent complications. Mm-hmm. I always try to operate under the capacitancy of the tissue that I'm working. Like I say breast. If I have a muscle that is not big, I can't put big implants. If I have a muscle that is weak, then I can't put a big implant, because at the end of the day, that implant is just going to fall down, and then you're not going to have the outcome that you expect. But most importantly is the mental component of this. We don't operate, when you have criteria, you don't operate based on patients' wants, you operate based on patient needs. So we try to, in us as professionals, we have that responsibility. Our responsibility number one is protect the patients from themselves.
Correct.
Yep.
From the social media, for what they see, for what my girlfriend did, my cousin did, what I saw on Instagram, what I saw in YouTube, what I saw in this, I want that. So it's our responsibility, because we're the educated ones in the field, to tell them, this is what's best for you. understanding that not every patient should be your patient.
Correct.
Yeah.
And I love that you mentioned all of that, especially bringing up the segue of social media. How has social media affected through looking at all these models and social media influencers? Because I know it's really affected us in dentistry, because we'll all get those patients that come in with the Instagram page and be like, I want to look like her. And frankly, it's very difficult to do that, right? Because not everybody is going to be a cookie cutter piece of that person. Everything has to be planned for their face or for their body type. So how has social media affected and helped, in a way, boost plastic surgery cases and change the way you practice?
Right. So the way you present your social media is the way that you want. See, I always say you're not Nutella. You cannot be like everybody. So the way you present yourself in social media is what you're gonna get to your office.
Agreed.
So there's always expectations based on somebody else's outcome, but I always try to promote individuality, understanding that, and the mental component is very important, because, and as we were talking off camera before, we were talking about the importance of self-love and, embracing yourself. If you don't embrace yourself, and you don't like yourself, and then you probably will like to be somebody else. And if you go into surgery trying to make you somebody that you are not, it's set up for failure. You're never going to be completely satisfied.
Now, how do you go about having that conversation? Because sometimes it could be a little tricky water, because especially nowadays, you don't want to hurt someone's feelings or get too involved maybe with the psychology of that, because there are patients that are sensitive, right? And there are patients that are, you'll say something like, are you sure? And they'll get offended maybe. So how do you go through navigating those rough waters when you're having that psychology conversation?
Going over that, I want, because it's very unique, like the way that you do your whole, your filtering through patients. So can you talk a little bit more about that? Because I know we've spoken about it, like how you do your consultations and how you take it from somebody that wants to be your patient to becoming your patient. Because, one of the things that we have in common, because we've spoken for a while, is the fact that we have our own touch in what we do, and we don't really, like you said, we're not gonna do what the patients sometimes want to have done, because like you mentioned, you gotta protect them from, sometimes they want something that is completely, cannot even be possible.
Right. So I as I said, the mental component is critical, and you always have to relay on the facts. One thing that is undoubtable is the anatomy. One of the things that I support myself very well is the anatomy. So as I'm doing my consultation with my patients, I try to show them their anatomy, and show them what's possible and what's not possible. But that's when they get to my consultation. But before that, I always do a virtual consultation in which I see the pictures for the patients, I talk to them, I see their expectations, I see what are their needs. And we have a conversation that is not typically a consult, is communicating. And if there is rapport between us, then we move forward. And then in the in-person consultation, then I get to show them what could be the plan that will be designed for them. And if they agree with that, then we move forward. If they don't agree with that, then I suggest always to get a second opinion.
Yeah, and that's the thing even in our world where a lot of patients go, well, I'm going to go back to that.
No, I'm just looking at Vince, because Vince is like, he's going to say something, then boom.
So, Vince, I was just going to say that even in Bart and I's practice, we always do a clinical exam interview. And I think that's super critical, and I know you guys do it as well.
Yeah.
And I love that you do that, because you kind of have to text and chat before you go on that date to get to know if you could sit down and go on that date. Unfortunately, there's a lot of patients that feel like every doctor needs to see them, and that's not necessarily the case. There might not be that rapport or that relationship that could go.
Yeah.
Right.
So I love that you do that. So going back, Vince, what were you saying
I was
before I
just gonna
really
ask you, 'cause
interrupted you?
You do your two-step process basically before a procedure.
Right.
How often would you say after that initial, you have that virtual conversation, are you saying, you know what, I don't think this is a fit, because everyone has had a patient where you have the red flags and you're like, you know what, let's just do it.
Yeah.
And then when you, halfway through the treatment, you're like, I would give you all your money back to not deal with what I'm dealing with anymore, because everything is unrealistic. So one, have you had, I'm sure you've had some of those patients in the past, which is why you
100%.
have this process.
Yeah.
But
I like how he
often-
opened his eyes. He was like,
Yeah. Oh yeah.
100%.
I have that name.
Yeah.
But how often would you say, you know what, I don't think this is a fit?
Right. And to answer to this question immediately, I will say that I will tell them to the patient immediately. I don't think we're gonna.
Right, that's a good fit.
I don't like to create, false expectation about my care. But the good thing is, at the beginning when I started doing this process, there was a high number of patients that I just did not. We were not aligned, and it's because the idea of comparing the practice that they already have visit to mine. So they want to create their own experience when we are responsible for creating that experience for them. So at the beginning, it was, it was heavy. We had a lot of patients that we just did not click. Now, because the way I present myself, and then when you have this process that is very strict, and because the word of mouth, I believe, that continues to be the way to get patients, then it happens less and less, because they already have an idea of how I work. They're looking forward to go through that process. So it's a different, I think it's a different situation now from one before. Before, it used to happen a lot. Now, less and less.
so the way you're marketing yourself, basically putting yourself on Instagram, is allowing for those patients to see what your ability is, what they're getting into. And I think Oscar.
No, and
Vince, all
usually
of us
that's
are
like
the
a
same.
process that, the younger you are in your career, you want to see everything, you want to do everything, right? Because you think that you want to please every single patient. And then what people don't realize is, like, if you're gonna be good at something, you gotta cut it down to something. You know what I mean?
You gotta
can't
do it your way,
exactly.
that you know how to
and then
do
you
it.
gotta do it your way. And then once you do it your way, the patients will follow, because there is different. Like, for example, in our office, like, we're two different personalities. So sometimes we have the issue, not the issue, but like sometimes Vince will click with a patient better than I would, or I can just walk into the room and you feel that right away. And I'm like, no, Vince, that's all you. Like, if I sit
Happens
down
both
next to this
ways.
patient and they're asking me 7,000 freaking questions, I will go crazy. You will sit there and just look at them and they will ask you, you will answer. It's two different types of personality, and that's why it works, But I can't see everybody. But that's something that I learned as I got a little bit more into my career, that I'm not here to please everybody. I want to do the best that I can, the way that I know how to do it, So that's why, and then what people got to understand is, like, as time passes, because it's going to take time, So you have to have a little bit of patience for this process to kind of start coming around and really you starting to see it work. And that's where I think you're going, that now less and less you don't have this issue, because now the people that you're attracting are the people that you want to attract in a way.
And I think it's important to understand that patience only comes when you trust in what you can do.
Exactly.
Because sometimes you think that your competition is whoever you have next to you, but it's not. The competition is yourself. Try to be better every day. And then by being better every day, there's a niche of people that are going to copy the message you're trying to deliver.
Yeah.
You don't have to have all the patients. You have to have the patients that relate to you, that understand what you do. And they will never question what you do or how you do it, because they understand. So, and it comes to me that I see that right now in the field, there's two types of experience that you can deliver. You can either deliver a memorable experience, or you can deliver a transactional experience. Transactional experience in which somebody has the means to pay for what they want, they get what they want. Or a memorable experience in which surgery is one of the things that they're gonna get. They're gonna get education, they're gonna change their lifestyle, they're gonna change their lives. So you have to pick a experience that you want to deliver and just ride with it. In my case, I only want to create memorable experience because I really like what I do.
Yeah.
Yeah.
And that's awesome. I love that because I feel like that's our
No, and your
vibe.
work is amazing. So, lady and men,
Right.
nowadays, everything, you know?
So you just said, you've kind of said this a couple of times, like memorable experience, like the psychology, getting the right patients. Like, what's your, I mean, I know it, but your treatment philosophy in your own terms, in terms of, you know, health over just beauty or making something fit for the patient? Like when you're approaching a case, like what's kind of your mindset? What's your breakdown?
Right. So one of the things that I learned is the mental component is key, because it doesn't matter my execution if my execution in the wrong stage of that patient, I'm not gonna get the good outcome. Let's say that I'm going to do a liposuction, but the patient doesn't have a healthy lifestyle before the liposuction, and she wants to get the liposuction because she just want to look skinny. What's gonna end up happening is that she's gonna get her liposuction. She's gonna get a good outcome the first 6-8 months, and then she's gonna go back to the life that she had, and then we're not gonna have a great outcome anymore.
Yeah.
So guess what? At the beginning, you know, when I was young, I liked to operate, and I would see that I had patients that were coming back. I know I want more lipo now. And then I understood, well, there's something that I'm not doing right. This is, I need to change something because I need to make sure that these changes that I get to be long-term. So there's something that I'm not hitting. So that when the mental component is critical. So I do my virtual consultation, which I talk about expectations and needs. I bring into the in-person consultation when I can show her what can we do based on what her needs are. And then once we agree in what we can do, then we start the optimization process, which is a multidisciplinary team that will help me change the lifestyle of that patient from the nutritional standpoint, from the psychological standpoint, and from the medical health point. So the moment that we take her for surgery, which is an elective surgery, and there's no reason why doing an elective surgery should be done under iffy situations. You should be at your optimal level.
Yep.
And that means that the patient has to be compromised already with their own outcomes. So I'm very involved with that process because I understand that it is still my responsibility long-term, the outcome for that patient, because their outcome is a reflection of who I am. So, and it should be a reflection of us.
No, it's true.
I love that. It's like a holistic, comprehensive care.
Yes.
Correct.
Nutritionists, you have like
Nutritional, I have psychologists involved,
It's amazing.
everything, because yes, it's more costly to do that. It takes more time,
Yeah.
but allows you to ensure outcomes and ensure what really is the ultimate thing for you to get, which is that the patient is actually happy and content with their outcomes, but not because of what I did in surgery, which I think I did a good job, is also the transformation process that has to go through that. Because patients, they get old and they forget about their surgery, but they will never forget about the memorable experience that you get them. And then you always will have that patient.
Yeah, and I don't think I've heard of any plastic surgeon or anybody that's really treated patients comprehensively like that. And I find that amazing. So kudos to you and your team for pivoting in order to allow patients to have that comprehensive care, because that's something that
That's something that we should bring also, like, you know,
Well, there's a huge education component that you almost have to remind yourself, like, okay, patients were not taught this information. Like we say a lot of the same things over and over every day that you think it's common knowledge, and it's definitely not. Or, you know, a layperson who they're not medically trained or dentally trained. So that education component is a missing key, I think, across the board.
And it is our responsibility.
It is.
very true.
It is our responsibility. And then, and I know this happened to you guys a lot. Then because you have to deal with the consequences of patients not being educated properly that go to another provider that didn't educate that patient properly, that set the false expectations, set the wrong tone, and then they go through a complication. They're not happy with their outcomes, and you have to take care of those patients.
Well, and that's fighting the psychology even double. Than
Yeah,
Double
but
because
it's go ahead.
Because it's not only the patient's responsibility, it's our responsibility.
Yeah.
And I think one of the biggest thing now is that we have so many, and it's sad, so many doctors that will do anything. So,
Especially
in your
in Miami.
field, especially in Miami, in your field, you're probably dealing a lot with like, well, I went this other place and they wanted to do it. Like, why you're not, X, Y, or Z, or I can get it done here for whatever. And we deal with that on a daily basis, especially in dentistry. Like everybody's just like, oh, I can just get it done this, there. And people like, and you see some of these cases, and since the beginning, they were set up for failure. And sadly, like the patients were not informed correctly. And it kind of sucks, like on our part, that we need to do better as professionals in general.
There's also patients that hear you, but they're not.
I was just thinking about that right now.
Yeah.
Right? So I've had those where you set the expectation, you have the difficult conversations over and over. You have text message receipts,
Yes.
and you continuously tell them expectations and possible complications, and yet they're still upset because they're not quite listening, right? And that's a very difficult part of it, because then they're talking to their friends, they got something in so-and-so, which isn't the ideal way of doing things. And now it puts it in a very difficult spot for me as a practitioner, because I know I'm doing my due diligence and doing everything I possibly can. Do you have those kind of patients?
Yeah,
How do you navigate around
no,
that?
I run through that, but that's the key of is like you are as strong as your weakest link.
Yep.
So as we are very self-sufficient, we think that we can do it all. So that's the importance of bringing a multidisciplinary team.
Yeah.
Because, for example, there's moments in which I think I have a great conversation with my patient, and I think that I'm delivering my message. But when I send her to the psychologist, I'm afraid to say to the doctor this. I'm afraid to say to the doctor that. He was very excited, so I didn't want to say anything. So that's the key of not getting all the burden on you. You have to be able to delegate to a team that will, hit from multiple places. In my clinic, it's not only the psychologist, it's the girl at the front desk, is the massage therapist, is the nurse, because the thing is that the goal, we all have a common goal, which is take care of the patient.
Exactly.
If everybody shares the same vision, those things that you're gonna lack, you're gonna hear, oh, you know why? I was talking to her and she said that this, and this, so you should talk to her about it. So I go, like Superman, with the information and say, you know what? I forgot to tell you this, and this. Oh, doctor, you know what? I was just thinking about that. And that puts you in a better position with the patient. You build a stronger bond with them. And at the end of the day, it's always the same thing. Taking care of the patient.
That's
Communication.
Very
Key
interesting perspective.
In everything in life, people.
Because I feel like as dentists, we are also psychologists that deal with our patients, undoubtedly. Because I sit there for the first 5-10 minutes before I even get the patient home. I'm talking to them, trying to ease the anxiety. But the fact that, Dr. Aquino, you brought in a psychologist into your practice and you incorporate that, I feel like for dentistry, that should be a given. Because there's some days, me and Fede are in the office, and I look at him like, God, it's only 2, but I feel like it's 8 p.m.
Yeah.
Like I was just talking to the patient. I didn't even do that much, but mentally I'm taxed.
Well, no, a lot of times, Oscar, you said it, and you said it as well, where a patient will go somewhere else and they're not either given any information or they're given the wrong information, whatever it is. And then you have a patient that comes in and you know how you can fix dentally, surgically.
100%.
Okay, this is how I can fix it, done. But getting past the not questioning your ability, but the mistrust that they now have, and then you were trying to fix it. You talked about you like to bring in details and making sure the body is super detailed, just like your facial training.
Right.
But when you're trying to fix the work that was done, maybe not as detailed, now you're fighting a battle and the patient doesn't trust you right off the bat.
Right. So I always say that everybody has a wound to heal, and sometimes is not the reason why they're coming. So sometimes you had to understand the motivation behind of what is bringing that patient to your door. And when you hit that, then the rest is easier. Because the mistrust is not because of the procedure that you're doing. The mistrust is because of the situation in which the patient is.
Yeah.
She feels betrayed because she was promised something and she couldn't get that. So I think the key to end the patient's trust is just being honest with what you can do. If you're honest to what you can do, and you tell her, this is what's possible, this is what's not possible. Unfortunately, this happened, but we have to move forward, and then try to help her navigate through her process. Not technically talking about the surgery as it is, but technically, helping her through the process or his process. I think that allows you to build the trust, because trust is not based on what you say. Trust is based on what the experience that you deliver to them. You can say whatever you want to say to them. You know what? I'm going to treat you well. I'm going to do this. I'm going to do that. That's not going to help. They have to see the process of you taking care of them, so they can immediately. And it's not hard. It's very easy when somebody didn't take care of the patient and someone is trying to take care of the patient. They will immediately see, wow, these people really care. So I think the mistrust is not about what you say. The mistrust, you can navigate that through the way you treat the patient, the whole process. And that's why it cannot be one-step process. It has to be multiple processes, so they can be able to compare the difference between who you are and then whoever is taking care of you.
What I've learned in the past, and you remember this patient, and it's funny you said this because patients do have wounds to heal. I did an FMR on this lady. She's in her 50s, beautiful girl, everything done. BBL, mommy makeover, and recently divorced. And I did her teeth, I did them in BL. And then she comes back 2 days later, oh, I'm so happy, I love them. 1 week later, before I'm ready to deliver, she goes, Oxandus, I don't like these. I'm like, why don't you like these? Like, what's going on? She goes, my new boyfriend said that they didn't look like I got my teeth done. I'm like, oh, the boyfriend. Bring the boyfriend and let's go talk. I mean, I ended up doing it all in one. But then when you said patients have wound to heal, she's, got all this surgery done. She wants to get back on the market, look her best in the fact that her boyfriend said that your teeth don't look white enough. That's what killed the case. But she loved it leaving, and then coming in, she's trying to, date, and, her wound is, she's going through that divorce, and she's trying to get back on the market and look her best. And meanwhile, she's like, her boyfriend is bringing her down. It had nothing to do with me. But thank God I caught that before, it would have been.
It happens to be very often. That's why I always investigate not only the motivations for your surgery, but also the environment in which you're going to be healing.
Yes.
Because it doesn't matter what you do, but what you're going to find out is, I always tell the patient, your best friend is my worst enemy.
Agreed.
Oh yeah.
Is your worst enemy, because she's going to be saying, well, but I look on Instagram, that's not the way you should be looked. Or you know what, my girlfriend did this in Colombia, or my friend did this in Dominican Republic, and it doesn't look, you're not healing the way you're supposed to.
Oh yeah.
Yeah.
You're going to run into that. So I always tell them that in advance. So when they hear it,
They already know. He told me about this.
it's like, she is a marriage between the patient and I.
Yes.
Is us against the world. You're gonna hear people try to criticize what we did, but they don't understand what we did. They were not in the process. They don't understand our relationship.
Yeah.
And I always secure them with, we're gonna win the long game.
Yeah.
You don't have to win the short game. You have to win the long game. The one that a year later, they look amazing.
Yeah.
And then you don't have to say anything.
But it's hard for a lot of patients though to understand that it's a longer process. Even us that we do veneers, full mouth cases, we're in a temporary phase, temporaries chip, they'll fracture, and then they get the upset, oh, my friend went to Costa Rica or Colombia and they didn't chip anything. Well, that's because your friend got them the same day, and that's why your friend looks like that.
Yeah.
Because it wasn't, or they got a bunch of cavities or everything, their gums are not looking great because it was done incorrectly, and there's a process to this, right? And I always tell the patients, don't think short term, don't think in the micro, think in the macro, right?
Yeah.
So similar concept.
Well, it is a
because
long game,
it
no matter
is.
what.
So it's
because you're
ideally
changing
that patient, you're
Yeah.
30 years.
Yeah,
40
and they're
years with
changing their lives. And in our case, they're looking in the mirror for the first time after 20, 30 years of wear and tear, and now they look completely different. And they got to get used to that. And then for you, they're healing, right? So swelling needs to reduce, lymph drainage needs to happen.
Oh man,
So
I bet that you get it. Because when I used to do a lot of surgery, the patients would just be like, "Is this normal? My face is swollen." I'm like, "You just had fucking surgery. Like, what do you think?"
Yo,
You
it's
know
so
what I mean?
funny
Like,
you said that.
Why?
Like, for the
What do
past
you think?
50 weeks I've gotten text
But
messages.
sometimes I just say, you know what? I see. Vince was saying that sometimes we think that they know what we know, and sometimes they don't.
Yep.
especially nowadays.
So that's the key thing. Another thing key is the follow up. Right now, you see that people get their job done, and the surgeon never sees them, never holds their hand through the process. So that's another thing.
Yep.
So if you're not there to help assist with that healing process, then of course you're gonna have a lot of questions like that because they don't know what you know.
No, and it's true. And it's also about the fact of giving the answers before asking the questions, So something that we've been doing in the office is we've been both sitting and we get the feedback from the patients that they're like asking me like random questions, like, my lip is this or that. And then those questions, I'm writing them down, Vince and I, and we give it to our treatment plan coordinator so that when she goes and speak with the patient, she's already touching these points because those are the things that like we've been getting
Common
back. But
questions
that's
that
like,
we're getting,
it's
yeah.
everything's about systems. So we sit down and we're like, okay, we're getting these common questions. Therefore, you guys need to tell them this.
Make sure you hit this,
Exactly.
this, this,
Hit this. And we do it. We've literally sat down with them and just write everything down and go over that because you don't want people like if you walk someone through a process and everything is laid out, pros, cons, this can happen, that can happen, then it's never an excuse anymore. At this point, it's like, oh, I already mentioned it, But if you don't mention it and then you're explaining it, then it sounds like an excuse,
Right. So I always say to the patient, all the information that I give you before procedures is information that is going to help you get to make an educated decision.
Correct.
Yep.
Everything that I tell you afterwards is an excuse.
Yeah. So if you say it in the beginning, it's an explanation. If you say it at the end, it's an excuse.
Yeah, exactly.
That's something that my professor taught me years ago, and I've never forgotten it.
Yeah.
You have to talk to them first.
And you never forgot it for a reason because it's the truth.
It's the truth.
It's a practical truth, and it's something that you live, that you live through every day. You actually see it every day, so it's very hard to forget. And then one of the things that you were mentioning is, yes, we should anticipate those questions, but you have to make the process yours. You can't. Okay, I have all the information that the questions that they're gonna ask. So I'm going to make my team deliver it. No, you'll have to be part of the process as well. And you know what? And reinforcing everything. Because that is going to hit also in the patient being able to see that you are actually taking care of it.
Yep.
For example, in my case, in my patient, they know that I'm paranoid, very paranoid. I want to know everything. You have a scratch in your knee, I want to know. Because I'd rather know than not know. Because sometimes the best friend said, oh, I had that scratch in the knee and it was no problem. And then something big happens, and then what do you do? At the end of the day, it's just taking care of the patient, and you have to assume the whole responsibility of the process. There's people that don't agree with me, that they're more laid back, but hey, for me, I'd rather don't have a lot of volume, but I prefer knowing all my patients, which I do by name. They're not numbers, they're patients. Yeah. So I can tell you that every time a patient sees me, I will talk to them like they were family to me because they are.
You're creating and cultivating relationships
For relationship.
for long term.
Correct, for long term, right?
Yeah.
So you and this is very old school because my mom is a physician, and I remember that my mom would go. Their patients were the people that in the market were selling things to her. See, and I fell in love with that process. I remember my patients taking in Dominican Republic that would never happen here, but chickens to my house, because so that's the way that they will
I'll be okay if you bring me a chicken. All you out there, if you bring me a chicken, down.
Chicken, whatever not.
Yeah.
So it's just that you create a community, you create a niche, and once you create a community, you don't feel like you have to compete with anybody else.
That's true.
I think that's awesome that, you watching your mom growing up as a physician kind of helped mold you in that sense. Do you feel like that specific memory or that going through that has really catered to that pivot that you did to go comprehensively?
Right. But I think it's a combination of both my mom and my dad and the people in the environment that I grew up. My dad, my dad is a lawyer, and then he was always with people. He was always talking to people, networking with people. And my mom was a physician, and she did her networking in her way. Awesome. But you're always a product of the environment that you're in and the decisions that you make.
Yeah.
Where do you see your niche particular practice going in the next 5 to 10 years? Like the advancements in what you do is body contouring, facial aesthetics, things like that.
I mean, the field that has evolved the most in the last 10 years has been body contouring. It continues to be evolving because of the technology that we use. So there's multiple aspects of it. I can go for hours talking, but I think there's a lot of future in body contouring, but at the same time, I see there's a little bit of I see this with the granular cell. Why? Because all these changes are leading us to modify our anatomy more and more. So I don't see them as great. I think that there's advantage in one things versus others, but I think we just have to be very, cautious of technology coming in and doing everything. Because everybody's obsessed with the immediate results.
Yep.
So because we're obsessed with the immediate results, technology allows us to get more immediate results and not quite, because we don't have the data to see down long term, we're not sure if that's gonna work or not. So I think even we're gonna be progressing in our field, we have to be cautious, in picking who use that technology in, thinking in the future. I think that's key.
And a couple of questions. What are some of the most popular procedures that you do and the procedures that you enjoy the most?
Well, I do, liposculpting is one of the most common procedure. But in my practice, it happens to be that more than 70% of my patients already have procedures done in the past. So what do I enjoy? And this is crazy that I enjoy this, but what do I enjoy of the procedures? I don't enjoy one particular procedure. I enjoy the challenge of every procedure can bring to me. Because in a way, it helps me be better.
And it makes you grow.
It makes me grow for sure. Because if I get the same procedure every day, if you see, I like this procedure, is because two things. You either feel comfortable with it, or you already know how to do it well. So you feel like you're not going to be challenged with something that you can do quickly.
And then you get bored.
It get bored.
Yes.
Right. So for me I get these cases, like fucked up cases, like in the daily, and I complain and say, shit, this case, whatever. I have to deal with this, and this should have been. One thing that I always say, this should have been done this way. Obviously, I don't say that to the patient, but this is. I mean, I should have been done this before, but whatever, I have to deal with it, and those are my best
And that
cases.
is a really good point because patients need to understand that not every doctor is the fucking same. Like, do not compare us.
Yeah.
You know what I mean?
No,
there is
not.
here, and then there is here.
Yeah.
And then we deal with the same crap. Like over 50% of our cases are reduced.
And revisions.
Higher than that.
Higher than that, yeah, revisions.
that,
And
dude.
it's like, yeah, you can see something one way, but from my perspective, it's like I could care less. A veneer, you get a great ceramics, they can do something beautiful. What I care the most is what's underneath, because that's what I have to work with. And sometimes, like these patients, they look a certain way. When I remove those those veneers, they're busted.
Nothing left.
It's horrible. The
Nothing
tooth is
left.
like destroyed. They put me like in a horrible position, and that's probably what you're mentioning. That they get all this surgery done by somebody that whatever, because we're all the same, and then you have to deal with trying to fix
Yeah, he has a
this
lot of scar
bigger
tissue
issue.
and things like that.
Interesting enough, they have the higher expectation.
Yeah.
Oh yeah,
Yes.
no,
They
always,
always do.
always,
Because because you're a good doctor, so I must have these outcomes.
Yeah.
You're the best in your field, so you definitely have to. I trust you, doctor, because you're the best.
Yeah.
But there's a lack of understanding that you're putting me in the worst situation
Exactly.
possible.
Yeah.
And there's no. I don't want to get the golden car for fixing you, but at least appreciation that the fact that you're bringing me a case that is
Compromised.
is
from the
already
beginning.
compromised, and I have to work with what I have.
Yeah.
Very
And then I
true.
have to set the expectation. And sometimes those expectations you're not gonna like.
Yeah, it's not what they
And
want to
then
hear.
There's not gonna want to hear. But one thing that I would never do is tell you one thing that I cannot deliver.
Because then that sets it up for failure.
So
from
that's
the-
set up for failure. Right? I say, you know what? In my hands, I can deliver this. You might have a 20, 30% improvement, but one phrase that my professor always said is under promise
Over-deliver.
and over deliver. I'm
that's
sure.
right. We all heard it. We all
Under
heard it.
promise and over deliver.
Over-deliver.
If you see somebody that's over promising,
Yeah.
run away
Run
immediately.
away.
Run away
Or the
immediately.
one day that you say, this is going to be a simple, you've
No, you
killed
never-
yourself.
yeah.
There's no simple procedure.
No simple procedure.
If you think that the procedure is simple, that means that you're not looking at the whole picture.
That's right.
Even the breast augmentation for me, breast augmentation are the technically more simple procedure that you can do, but it has the evaluation, the anatomy, everything. If there's something that goes wrong, you might not see it the first year. You might not see it the second year, but you definitely will see it the third year, fourth year, fifth year, because your body is gonna always go to what's normal for them, not the implant.
So, go ahead, Oscar.
No, I was going to ask you another question. I was going to ask you, so right now, just so that listeners know, like more or less, what is your time? Like if a patient wants to come see you, like how booked out are you, or how long does it take for them from the initial consultation onto the procedure kind of starts?
I do things differently, right? If I wanted to be booked out, I could, but I made a choice not to be booked out for two reasons. Number one, because once I start the process with you, I want to follow you through the process. Because if I see this patient in August, right, and she books for January, and I don't see her anymore, the optimization process for her to get her surgery will fall. Meaning, we're not going to change your habits. We're not going to have that psychology on board. We're not going to do everything that we need to do so you're ready for the surgery the day of the surgery. So I'd rather have not book myself too much in advance and have 2 months that I can work hard with you, you know, and then do your surgery. I did that book in advance in the past, and I'll get patients that I'll see, and they will be 140 pounds, and when I see them a week before surgery, 180.
Oh, jeez.
Changes everything.
But more or less, what's the time? Like from the minute that a patient talks to you to the surgery happens?
It could be a span of 2 months.
2 months?
That's awesome.
Yeah,
Because that's the time that I prepare them. And see, one of the things that I notice is that we're, as humans in general, even us, we're very arrogant to believe that we are always ready for the challenge that we have ahead. And by that saying, surgery is a stress. And the fact that you had no medical problems doesn't mean that you are able to withstand the stress of the surgery. It's like for me to say, you know what? You want to run a 12K marathon tomorrow? Will you be able to run it?
Well,
I love that.
Not today, but
I love that. That speaks in our world.
I'll try.
Right. So will you be able to run it?
Yeah, no, yeah.
You won't be able to
Yeah, of
because you
course.
have to train for it.
Exactly.
So the same thing is surgery. Surgery is anesthesia. Anesthesia is an induced stress. So you have to be able to be prepared for that.
Yep.
If you get someone, I'll operate you tomorrow. Doctor, but I have no medical problems. I'm sure you do have. You always have. If you don't have a medical problem, your body is probably under stress. If one of the things, we're all under stress because we don't eat well, or we not exercising, or we are not sleeping well.
yeah.
Because that's the balance. Sleeping well, eating well, and exercising. That's the key.
How's that going, Bart?
It's going well.
Yeah.
3-4 hours.
And one of the things that I get the most, doctor, but you know what? I'm okay with I'm going to heal because I used to heal well in the past. Yeah, I used to heal in the past, but remember, a lot of things have happened since that past. So just because you have a great wound in the past doesn't mean you're going to have a great wound today.
Cells change.
Everything. Like I
Everything
said,
changes.
we are constant consequence of our own decisions. So you're always going to be changing. So what worked for you yesterday is not going to work for you today.
Agreed. Where can patients connect with you?Here can patients see you in your practice?
In terms
Instagram,
I have
all
my
of that.
Instagram. My Instagram is dr.joseaquino.
We're gonna write it below.
Yeah, we're gonna
I don't even know it myself, to be honest.
I
You put
really-
me in this spot. What he means?
I've really enjoyed this talk because I feel like we're very aligned
Yep.
in how we treat
Yeah.
everyone in this room, our patients. And it's refreshing to see that, especially in the world of Miami, in the world of BBLs, glitz and glam, that there are practitioners that still see the patient holistically, because that's something that I feel like we all very passionate about. So I've loved filming this podcast with you, Dr. Aquino.
Thank
and
you
it's
for
been
the
a
opportunity.
pleasure.
Thank
to
you
have
for the
you here.
opportunity.
No, this is awesome, guys.
Yeah.
This is pretty awesome. guys.
Aquino, remember.
Aquino.
Aquino, guys. No one's
Aquino. It's Aquino. And thank you so much for listening. I hope you enjoyed this podcast. Please connect with Dr. Aquino and with all of us here on the pod. And I hope you enjoyed it, and we'll see you next time.
Thank you.
Thank you.